Welcome back to Getting to the Root of It. This is a video series brought to you by Mental Dental and Colgate, where we talk with professionals in the dental field to provide background on the various career options available after graduation from dental school. Today, I am pleased to be joined by Dr. Camila Lanfredi. She graduated from dental school at the University of Sao Paulo in August of 2008. Since then, she's been seeing adults and children every day as patients. She has a clinic with 4 treatment rooms in partnership with her sister, who graduated from the same university in 2004. Their focus is on prevention, education, and oral health. In addition to practicing pediatric dentistry, she works a lot in the area of endodontics, in which she specialized in 2014. In 2013, she did her master's degree in the field of dental sciences. Today, she has 8 dentists serving all areas of dentistry at her clinic, and in addition to attending the administrative parts as well. Thank you so much for joining us today. It's great to have you here, Camila.
It's a great pleasure.
Wonderful. So maybe we could just start with you sharing a little bit about what brought you to the specialties and the areas of dentistry that you practice today.
Well, since college, I always wanted to work with children. It has been always very easy for me to deal with children. I like it. And well, I think they are the future. I think it's very important to us to prepare them for the world and for what we expect for the future. Yeah. So it has always been on my mind. And as I graduated, my sister already had a practice. So I started to work with her, and she always worked with children. And our first patients were family. So all the children from our family were treated by us. And then we started to study more and to get specialized in this area. And today is the focus in our clinic, because we love prevention. So we have a lot of tools, and we study a lot about it, and we try to always get our patients educated for the importance of having an adequate oral health. So, and to deal with children was always a dream for us. So all our clinic is prepared for them with special places and everything very adapt to them. So for their comfort, and so that they can integrate in the world of oral health. And well, basically, that's what led me to this specialty, right? But then one thing brought to another, because I also love other areas of dentistry. So also endodontics was something I really loved doing at college, and that's difficult to find, right?
Right.
A dentist that loves endodontics. And my sister didn't like at all. So we decided that it would be also very important for us to have an endodontic at the clinic. So I went for it. I did the post-graduation, and I also do endodontics in children and adults. I do a lot of prevention with adults. I'm not a periodontist, but it's also something I love, because I think it's the base of our field. So that's why I act in so many specialties, and I think that's the passion brought me to this embracing of so many specialties.
Mm-hmm. That's great. You mentioned the importance of children having a good, strong start to their oral health journey, which is true. Like they really need to have a positive first impression when they see the dentist. Otherwise, a lot of times children won't come back when they're older. So that is so, so important. When do you first see your pediatric patients, Camila, and how often do you tend to see them?
Most of the times they come by the age of 1 year old, and they come every 6 months. But some parents bring the children earlier, because I think now there's been more communication with the medical field. So many pediatric doctors, they send the children to us. They do this orientation for the parents, the importance to go earlier, to have all the orientation. And so by 1 year old, most of them are coming to see us, and they do come every 6 months. The parents, they know this importance because they are there at the appointment, and they understand all that we are explaining, and sometimes wow, I never had this information. So it is also important for the parents. And what the parents tell me is that every time they come, they get very motivated at home. It's easier for them to do the brushing, and they get very involved with the process, the kids. And so that's very gratifying, right?
That's wonderful. And that is especially with a prevention focused practice like you have, I think the oral health or oral hygiene instruction and the education is a cornerstone of that, because like you said, you have to get the parents involved to do the brushing of their children's teeth, especially when they're super duper young. So that is a really important part of it.
Yes, and also many parents come to see me. Can you also treat me? And I think that's why nowadays I treat so many adults as well, because I think this first contact is very important. They get also very involved. And
Yeah, I think that's really nice too, how you mentioned the coordination between the medical pediatrician and the pediatric dentist. That's a really nice network to have, because I feel often in the dental world, we bubble ourselves with other dentists and dental professionals. You know, there's a pediatric dentist and then an orthodontist that they work really closely with. But to have a pediatrician and a pediatric dentist is also a really powerful referral network to have, not only for sending patients to each other, but also checking in with each other on patient health. So that's a really nice thing to highlight, I think.
yes, it is. And I think that's also what led us to have so many children, because our practice is in a area in São Paulo that has many hospitals, and we have a lot of doctors in our clinic, and they come with their own children, and then wow, when must I send my patients here? Well,
Right.
with 1 year old, well, when they have one tooth, they should come to visit us, or better, before than that. Because once the tooth is there, the parent must know how to do the hygiene, the brushing, and what paste should he use. And the parents don't usually know that at the first child. So that's really important, and they see this importance, and that's led us having so many children in our office. I'm very happy in what I do, because I get this connection with my patients, with all the family. And most patients I treat, the parents, the grandparents, and even the grandparents. And I think that's because I like to do that. I like to get emotionally involved with my patients, not, to know this family, what are their needs. And well, that's what makes me happy in my day-to-day. So I don't know, the students there that are seeing this video, that's okay if you don't like this connection. I think there are fields for everybody, and I think there are patterns of patients for everyone. Some patients don't like that, some patients like more. But I say to my patients, that's what makes me happy. Because my appointments, I stay with them, I talk to them like for more than 30 minutes, and then I do all the procedures. So I like this connection. I like to have this time. I like to have this mutual exchange. And that's what really makes me happy. See that somehow I'm reaching them and showing them the importance of having oral health.
Yeah, that's wonderful. And we're already talking about it a little bit. Camila, could you talk a little bit more about the specifics of your day-to-day routine? I know you said you have 4 treatment rooms, you practice with your sister. Like, how many patients are you seeing per day? How many days do you work, and those sorts of things?
I work every day from 8 a.m. to 7 p.m.
Wow.
So basically, I pause 1 hour for lunch. And in average, I see 6 to 8 patients per day. It depends on what I'm going to do. But with the first appointment, I take like 1.5 hours with the patient to explain. We have a lot of demonstration, like a big mouth. It's a huge mouth and with bacteria. And I also have a dinosaur. And that's really nice because the kids love it. And so I do a little theater with them, with the dino. I say, wow, he's eating. And in our mouth, there are a lot of bacteria. And every time they come there, I do the same. And they already know the names and how should they brush. They show me in the huge mouth how they should brush. And that's really, really nice. I always use a plaque indicator, and I always take photographs with my intraoral camera. So I do the photo before coloring, and then I do the coloring, take another photo, and then I always show them how to brush. I do it first, showing the parents how they should brush the kids, and then I show the kids with a mirror how they should brush. Then I give them this brush, and then they show me how they do. I do the orientation, and then we start the cleaning process. In my office, I use a new equipment. It's called Airflow from EMS, the company EMS, and it is like it's a spray, but the powder used in that spray is natural sweetener. And the great thing about it, it's the granulation. It is very, very thin. So I think bicarbonate is like 60 microns. And this powder is like 14, so it's very thin, and it takes all the plaque away, and it does a very, very good polishing. And the RDA, so the granulation, it doesn't make any harm to
Mm.
enamel
Oh,
or
okay.
dentin, so it's a wonderful equipment. And well, but children under 5 years old, they don't always accept it because it's a little bit strong. It
Yeah.
makes a little noise. So, but I always do all the professional cleaning in all the children's. I show how to floss. I show all the alternatives, flosses for kids, flosses for adults. I show the parents what kind of paste should they use, the amount they should use. So basically, the first visit, it's like that, but I do
Mhm.
it all over all the time. They come always. I do it always. So I think that's very important to stay in their mind, the correct form.
Yeah. Yeah, the visual aids are always so much fun with to use with the kids, like you're saying. I think that really sticks with them, especially if you get them brushing the dinosaur teeth and show them that. I love the indicator, the caries indicator paste, or do you use the little tablets or the rinse or
I use the EMS, they have like a little sponge.
oh, okay, little sponge.
It's really good. But for kids, I use one that it's liquid, but uh, it's not so liquid, but I do it with a pencil.
Oh,
But
okay. You
at
just put
first, I used to use the
like a little
how to
chewing tablet, kind of.
yes. At first, I used to use those, but they accept better with the pencil,
Oh,
and
okay.
it's also easier, and it colors better. It's very strong.
Mm-hmm.
It gives me more time to take it away, but I think it's more precise. So it's and that's what it's very nice to have other dentists working with me, because we discover very others materials, very good
Right.
materials that we didn't have knowledge of. So I think this is very positive to have this collaboration. Exactly.
Yeah, that's great. It sounded like you were describing to me the like Profi jet, like where they shoot out it kind of shoots the granulated material you were talking about. So the
Electrical.
air polisher. Yeah, very cool.
It is. I'll show you I'll send you videos. I have
Yes,
videos
that'd be
doing
great.
it in the children. I did it this week. I have also students working with me. We have four in our
For
clinic,
interns. Wow.
yes, and I love them. They help me very much. We exchange a lot of knowledge, and it's also wonderful. And they also bring us new things, you know, different things that they are learning at college that was
Mm,
different for me. And then they give me this will to be always searching for more knowledge and to go after researches to know more, to stay updated, right? So it's really nice. But I forgot to tell you that at the end of the practice, or at the end of the cleaning with the kids, I do the final photo, and they
mm.
love it because I take the computer and I show them the before and after. and it's clear to see that it's much more brightening, and well, they see the difference. They see, and when they see also the colored areas, they get always wow, because and I tell them that's why it's so important to come to see me every 6 months, because we do the brushing at home, but the teeth brush one will not achieve all the areas. So some areas are going to fail. That's why it's so important. And it's really nice. It's been really nice.
Yeah, that's a great thing to establish so early in someone's life, that they really grasp the importance of cleaning their teeth and coming to the dentist regularly. So that's great.
Yes, yes.
Dr. Camila, one more question for you. You already mentioned a little bit about the emotional attachment with patients is a good characteristic to have if someone were pursuing a pediatric career. Can you think of any other characteristics that might make someone a good fit to become a pediatric dentist?
Well, you must like kids, and you must be empathic with the parents. So I think I'm a much better professional now that I have 2 children of my own, because now I know the difficulties at home and how things really work. Because when I did not have kids, everything seemed so easy. So now, with my experience, it's really nice, because I tell the parents, okay, you're not alone. I also had this difficult, and well, you can do this to try something else, because it might work, it might not. Some days it might work, because kids, they are like us. They have good days, they have bad days. Some days they are going to be willing to do that, and other days they just don't want at all. But
Right.
well, they have to brush every day, 3 times a day at least. So it's not easy, and I know now that it's not easy also for the parents, because we have a lot to do with our kids. They must get them ready. There are so many other things that we have to think and arrange. So I think it's very important when you work with any patient, is to put yourself in the position of the person you're treating. I try to do that all the time. And I think that's what creates connection with my parents. And I think that's why they trust me so much. And I think that's why I love it also so much. But well, I told you I have many students working with me, and I see that some students don't like so much this connection, and that's no problem at all, because there are so many fields in dentistry that you won't need this kind of personality. So it's fine. I think it's a wonderful field. I love it. I don't see myself doing anything else. So, and I think everything we do with all of our heart and all of our will always be gratifying. So I don't think that you must have some characteristics. I think there are a place for everybody. So especially at dentistry. So if you're studying, I'm sure there is a field for you. There is an area that's going to be perfect for you. So it's very important to know what you like to do. And sometimes it comes with the practice. So when I started doing anything, prostheses and even I also did specialty in implantology. I did not tell you that because I don't do it anymore because it does not make me happy. I get anxious. Uh, um, I don't know. I don't know how to deal with the problems when they come. It's different with the other areas. When a problem comes, I get excited to solve them. I get wow, I'm going to do this. I know how to do this. I know how to make it work. Like in endodontics, I have the microscope and I think it's very challenging and that's why I love it. But in implantology, it's not challenging at all. It makes me so I don't do it anymore. And I think when we are searching for our place in our field, we must read these signs. Our mind tell us, no, that's not for you. So I think that's the most important thing for the students to know what makes you happy, what makes you comfort. And you will find it with time, it comes to us. You just need to have the courage to read your signs, to read your feelings and go with the flow in the right direction. And it's okay to graduate and don't know what area do you like to choose. I think things will come in time. So that was my experience. But at the beginning I got very nervous about it, about things that I did not like to do. I was very preoccupied. Oh, I must know how to do this. No, if you don't know how to do this, you can send it for a friend that knows better than. So that's what I do nowadays in my clinic. I have many friends working with me, friends that that study with me at college, and I have all my trust in them. I know they are good and that they love what they do. So, but it took me many years to be here so happy and so confident because I had to read all those signs and accept them to be where I am now, so happy with my professional career.
Mhm. Yeah, that's wonderful. Thank you for sharing all that. There's a lot of great advice there for people who may not know what exactly they want to do, for especially not in the first couple of years of dental school, but maybe not even upon graduation. I have some of my own colleagues from dental school who swore they would never touch endodontics, and then 5 years after graduation they say, you know what, this is actually, I think, the best fit for me after having done a little bit of everything. And so you can decide that later on, and like you said, as long as you have the awareness to look into that, to kind of read yourself and say, what do I really enjoy doing, what really makes me happy, what am I most passionate about, and then following that path, even if it's later on than you would have thought originally.
Exactly.
Well, Dr. Lanfredi, thank you so much for your time today. It was very fun to talk to you, and I appreciate you sharing how you got to where you are today, and just a great doctor for those young kiddos and getting them started on the right foot.
Thank you so much. I'm really honored. I watch your videos, I study with them. I think, and it's wonderful to study again all that we had it in college. I was very honored with your invitation, and thank you so much for the opportunity. And it was a great pleasure